everyone, thank you for coming to my presentation. My name is Amanda Ernst and I am a doctorate student at McKendree University, but I'm also the nurse educator for St. Elizabeth's Hospital here in O'Fallon. So today we're going to talk about enhanced learning with simulation, and that includes a high fidelity simulation mannequin purchase. Let's talk a little bit about our objectives for this presentation. So at the end of this presentation, you should be able to understand the benefit of simulation in nurse learning and nurse practice, identify the advantage of a high-fidelity simulation mannequin, and analyze the expenditure needed to create a simulation lab. So what are some of the benefits of simulation? It helps nurses perform physical tasks, critical thinking, and team dynamics in a safe atmosphere. This is incredibly important because as an adult learner, the nurse is sometimes hesitant to perform in a situation if they're unsure of their abilities. So providing that safe atmosphere is the very best way for us to help those nurses become confident in situations they may not otherwise encounter outside of a true patient experience. It may be used in a variety of professions while increasing interdisciplinary teamwork. We are nothing without each other in the hospital, so to perform in an interdisciplinary fashion helps us practice those skills in the real world. So we can use this for physicians, respiratory therapists, PCTs, CNAs, emergency technicians. We could even use simulation with ancillary departments like lab or CAT scan. So there's any variety of things that we can do, but we can create the situations to be more realistic, and being more realistic means that it involves more people, because nothing functions by itself with just a nurse or just a physician. It's actually preferred by about 70% of nursing staff, and we saw this as well in our Skills Days studies over the last year. Nurses want better hands-on opportunities to learn. So providing hands-on learning and immediate feedback is exactly one of the benefits of simulation. Not only does the nurse get to practice the physical skills involved in providing a patient scenario, they also get to practice the emotional and the mental skills and the critical thinking necessary to be successful in some of those environments. Simulation also provides immediate feedback, especially at the higher levels of simulation. The nurse immediately sees whether the intervention they are performing helps or hurts the patient. So providing that immediate feedback within the scenario and then a comprehensive debriefing after the scenario can really help the nurse figure out what works and what doesn't in a situation similar to that one in the real world. It may be used in a variety of patient settings. That includes critical care, emergency medicine, obstetrics, and general nursing. So we have all of those specialties within our nursing departments, and of course also with our ancillary staff, including physicians. So having the ability to provide simulation in those atmospheres really helps the nurses pull that knowledge together and create a more comprehensive plan of attack. And then, of course, simulation increases the nurse's level of confidence and communication skills. 90% of what we do in the hospital is communication. That's why we perform bedside shift reports. That's why we try really hard to use the SBAR format when we're communicating. Simulation can help us enhance those skills because people have to communicate with each other in order to be successful within this scenario contexts. There are several different types of simulation. Low fidelity models have very little or few electronics. So actually an example of a low fidelity model is the blue guy here. So this is actually a model that we use for our BLS, ACLS, and PALS classes. It's just got a clicker on the inside. It does have some inflatable lungs. So you can see chest rise when you're performing CPR, and you can hear a click if the depth of compression is deep enough. That said, that's it. It's obviously not very realistic. There's a minimal amount of things that can be done with the mannequin short of the objective, which is CPR. So mid-fidelity models are capable of providing a more realistic simulation, and they may or may not combine some electronics with those physical attributes. So for example, we have a picture up here of a mid-fidelity model, and you can see she's got an NG tube, so the nursing student or nurse would have had to place that tube. She has a tracheostomy and is currently being oxygenated using that tool, and they're starting an IV over here. So This particular mannequin cannot respond to the care that the nurses are providing, but the nurses are able to practice the physical skill or the process needed to perform those interventions. And then there's high fidelity, and that uses a technological interface to function as a realistic model, and it's capable of performing full scenarios. And it's different in every scenario, but one of the ways that we do this is we actually have a computer screen outside of the room, and that computer screen is hooked up to both a camera inside and a speaker system inside. And so the person operating the simulation can actually see and hear everything that's going on inside of the simulation without giving away any of the answers or without making it less realistic by being in the room. And so here you can see this patient is actually hooked up to a monitor, and that's one of the main goals here, is to make it more realistic. And there's several people involved, so everybody has a task, everybody has a role, and they have to work together as a team in order to be successful. So this is Apollo. This is a high fidelity model that I'm proposing we purchase. It's capable of realistic airway manipulation, including insertion of airway devices, so that makes it a great tool for our EMS or our doctors. It provides chest rise and fall. It reads actually a finger SpO2, and breath sounds are delivered over all lung fields. And there's also the capability of inserting a chest tube and suctioning the patient, all of which are things that are not available in a mid or low fidelity model, and all of which make the situation more valuable because these are tools and trades and interventions that the nurses don't get to participate in very frequently. He's able to be defibrillated using live electricity, which means that our nurses could use our defibrillators, which is exactly what we want them to do, is practice on the tool that they're using. And it shows a dynamic 12-lead EKG. So this helps us not only with our rhythm interpretation, but with identifying what the intervention should be in relation to that rhythm, and making sure that we are following ACLS, BLS, and PALS guidelines when treating patients who are having arrhythmias. It also allows for a blood pressure auscultation and for pulses in more than one place. His pupils are reactive, and he's capable of sounds and speech. And this is really where this type of technology shines. In a typical mid or low fidelity model, we are giving a story, but we're not really able to present the story as in a true scenario. In this manner, this mannequin can actually speak, and the way that that works is that the instructor on the other side of the wall or the other area of the hospital actually can hear what's going on inside the room, and they can talk as though they are the patient. So it gives you a true one-on-one patient experience instead of a instructor-student relationship. He's also capable of having an NG tube placed with gastric suction, which is again something we've not currently been able to use our mannequins for, and there's bowel sounds in all 4 quadrants. He's capable of a large variety of other things, but this hits the main systems that we would want to talk about. Some of the simulated experiences for Apollo actually include anaphylaxis, heart failure with pulmonary edema, severe asthma, and a subdural hematoma. All of these are difficult things to portray when you're talking about a mid-fidelity or low-fidelity mannequin. There are also real-life environmental things that we need our nurses to be prepared for that we don't necessarily see very often. For example, our ER nurses maybe see severe asthma all the time, but it's very difficult to demonstrate a subdural hematoma in that population. Some of our floor nurses may have never seen true anaphylaxis. So if we can provide these simulated experiences, they're more likely to be capable of providing great care to those patients during their greatest time of need. Some additional options actually include simulated wounds and injuries, which would be a fantastic addition to our current trauma and triage classes. And there's a pre-hospital and triage arrival mode as well, which gives some other opportunities like a cric or a needle decompression. Both things are really important as far as our trauma cases are concerned in the emergency department and potentially even in the ICU. There's more learning modules available, and the instructors can create learning modules for themselves as well. So what can we use simulation for? Our key areas here could be the nurse residency program. Here we have nurses who are trying to build a framework of how they should act and behave in certain clinical situations. It's very difficult to do that until you have experienced those situations for yourself. By creating a lifelike simulation, the residency program can enhance the education that we're giving these new nurses. We also have a patient care technician program. Just because Apollo is capable of managing high-tech situations, it doesn't mean that he's any less valuable as a mid-fidelity or low-fidelity model. So our patient care techs may not be reading the monitor, they may not be defibrillating the patient, but they certainly do need to practice oral care. They need to practice turning and moving the patient, and they need a basic understanding of some of the things the nurses are looking for, so wound care and things like that, so that they know when to alert the nurse in a critical situation. Of course, one of the greatest needs is for our mock cardiac arrest and critical care aspects. So we use the Be the Hero program currently to do mock codes throughout the hospital. The program has been successful in helping us increase the confidence level of our nurses. But again, we're very limited by the type of mannequin that we have. We are not able to demonstrate true rhythms always on using the same equipment that we have. We're not able to let them put the pads directly on the patient. We're not able to intubate, and we're not able to bag necessarily as effectively as we could with a high fidelity model because we don't have breath sounds and we don't have maybe different neurological conditions that the nurses may see on the floor that lead to our mock code scenarios. Certainly in critical care, chest tube placement is always a concern of our nurses. And a lot of our nurses feel that they are underprepared to suction a trach patient. This is something we cover at skills days, but again, without the appropriate materials, they're really learning by listening rather than by doing. So having a simulation model that's capable of those procedures really would help them get the hands-on training that they desire. Of course, it would also be very beneficial in our trauma nursing core curriculum training. So this class is based on trauma care for the ED provider. But it is an algorithm of an ABCDE, so airway, breathing, circulation, disability, and exposure, and it allows the nurse to go through the entire algorithm in the context of a trauma patient. This particular simulation model actually does have an add-on that can cause uncontrolled bleeding, and that's the very first thing the trauma nurse should check for on arrival of the patient to the room. So again, with the ability to actually mimic those real-life situations, the nurse can address them in a little bit more realistic way than if they're just talking through what's potentially happening to the patient. Of course, we do host skills days twice a year, and in those competency days, we can use this mannequin or even the entire simulation room to enhance the type of education that we're giving. This mannequin actually is transportable. He's a little heavy, but he's actually able to move around. So we could put him in the skills days themselves, and we could potentially bring him to the other hospitals so that all of our nurses are able to have the same experiences. And then finally, when we teach our ACLS, BLS, and PALS class, one of the most important pieces of those classes is the mock code or the mega code. Having this type of environment where the patient is realistically simulating injuries or problems would really help us create a higher quality mock code situation. So here we have a mannequin that can actually take the drugs that you're giving them. They can actually be defibrillated using the same equipment. We can actually put an IV in when we say we need an IV. So all of those things seem like they are simple hands-on activities that the nurse needs to do, but without physically practicing them, it can become very stressful for that nurse to handle those critical care situations when they do arise. So let's talk a little bit about cost. The actual cost of Apollo is, without our discount, about $53,935. The company, CAE, is actually willing to provide a discount to HSHS Systems, so the resulting price after that discount is $44,173 and some change. That does include the PC that we need and the installation, and it also includes a Touch Pro wireless patient monitor, and that's the monitor we saw in the previous slide that looks similar to an iPad. We get the learning modules for Apollo, which is included the 4 scenarios that I talked about, and then of course shipping and handling to get him here. One of the other benefits, though, is that they do offer on-site education for at least one simulator. My proposed process here says that we should actually have 2 simulators. We have 6 educators here at St. Elizabeth's Hospital, so if we can educate 2 of them on site, they can actually help us educate the rest. So we don't need to spend more money than necessary on making sure that our educators are well equipped to run the technology. Total cost here is expected to be about $50,923. Of course, there are some additional expenses, so one of those is the use of a patient care room. After a lot of research into what may be the best location, we've decided that the location in the CDU room, CDU, which is room number 1, is actually the best location for a simulation lab. This room is large enough to handle a group of 5 or 6 people. It's small enough that one camera is able to visualize the entire space, and it's actually adjacent to an office that we could use for simulation equipment, including the computer and the video equipment, so that the simulator can sit in that room and actually provide the experience. We will need to provide video monitoring of the room, and that would be provided by Intelligent Video Solutions. They also have voice control materials and technology, and again, we need to provide simulated trained staff members, which is a part of the initial proposal. So this vault-based license is actually the video network that we would need. You do need 1 camera for that, and of course a licensing software, and an audio networking system. That is so that the simulator can actually talk to the people in the room and vice versa. So we'll need a ceiling mount microphone for that and installation. And then of course on-site training to use that equipment as well. They do not have a limit to the number of people who can attend the training. And then it is annually licensed at $4,500 a year. So the expected expense initially for the additional expenses is $13,846. So let's look at the 3-year expenditure for the simulation lab. Year 1 is of course the most expensive because we have to put the outlay for the initial equipment purchase. The simulator again is just under $51,000. We do have to pay for a warranty, which is discounted for the first year, and then the video recording equipment and training. There is no salary requirement. Since we do have 6 educators, we would be capable of providing simulation experiences within the realm of the salaries already paid to those employees. The room is the biggest variant. So our average daily census in the CDU currently is 7.6 patients out of 10 rooms. So we don't typically need, in fact, about 90% of the time, we do not need room 10 or room number 1, I'm sorry, in the CDU department. That said, there is a certain number of days that room would have been occupied. And at about $1,100 in reimbursement per day, or $1,100 total cost, reimbursement is about 70% of that. It works out to be about $539 per day that we would be using a CDU room versus using it for a simulation room. So it's impossible to gauge exactly what the expense of that lost room would entail, but again, it is 1 room, and we do tend to move our patients into the PACU area if we're completely full. So there are other spaces that we can utilize for that purpose. And based on the benefit of our simulation equipment, this is a great opportunity to use 1 space for in a lesser used area of the hospital. So year number 1 comes out to a grand total of $66,180.96. Year number 2, we just need to pay for the ongoing warranty for both things. So the video recording warranty is $4,500, and the regular warranty on the simulation equipment is just over $5,000. So our total there is just under $10,000 for year 2 and year 3. And we would propose that in years 4 and 5 or 6, that number would be about the same. So overall, the initial expenditure is not huge in the grand scheme of things, and the additional expenditure beyond that is really not that bad, about $10,000 a year. So how does this fit well in our organization? So our core values include respect, care, competence, and joy. And one of the number 1 things that we can help with as educators is that level of competence. So we have the increased value of our classes, the classes that we've already created, or the AHA classes, or our trauma nursing class. all of those would increase in value with a higher level of simulation. Participation would increase as nurses begin to realize they're getting hands-on training and that they are in a safe environment where nobody's going to judge them for their behavior or what they do. They will start to participate more willingly and want a larger variety of classes. Nursing satisfaction is a key factor for this. Nurses who get hands-on opportunity are more satisfied. We learned that 70% of them preferred simulation techniques. So this would be a huge satisfier for our nursing staff and would help us take less time to help teach them the same concepts. So this is a advantageous way of educating our nurses. Of course, it also helps with our interdisciplinary teamwork, which helps us with our core value of respect. So we can include doctors, physicians, PAs, NPs, and certainly our ancillary departments, respiratory, CT, any number of places, even our speech therapist or our stroke coordinator or our STEMI coordinator. So if we can work as an interdisciplinary team, we're teaching the nurses that they need that support as well in the real environment. And then, of course, physician satisfaction. Our physicians want our nurses to be competent. We want our physicians to know that if they send their critical patients out to a telemetry floor, that they're going to be well cared for just like they would in the ICU. We also want them to know that we have the highest level of training available. And there's many times that our learning residents, our resident physicians, would benefit by having this simulation equipment as well. And then last but not least is patient satisfaction. Nurses who are competent have time to give care and joy. If the nurse is not stressed out about a certain situation or a clinical environment that they're in, they have the ability then to show the joy that they have when caring for their patients and really give high quality care. So all of these work together and really fit well in our organization as our core values would imply. So how feasible is it? In the market outlook, there are actually no internal high-fidelity simulation labs at hospitals within 100 miles of HSHS St. Elizabeth's on this side of the river. So our hospital partners with several schools include Southwestern Illinois University, so SWIC, Southern Illinois University, McKendree, Beck School of Practical Nursing, and St. Louis University School of Medicine. Having a simulation lab like this one would be a huge draw to our nursing schools. And we get many of our qualified residency candidates out of our nursing school associations. So having a high quality simulation is really a draw to both new colleagues, just because they want the experience, and to our new nurses, which is really the workforce that we need to pull into the hospital. Of course, as mentioned, the simulation model is portable for use at all 5 of our Illinois Division hospitals. So for our skills days endeavors, this would be a fantastic tool. And then the use of high fidelity simulation may actually attract nurses and residents to HSHS. So if we can really create a high fidelity simulation program, we can use that when we're advertising as a benefit, as an added thing that the nurses get to enjoy when they come to our facility versus some of our local competitors. And then, of course, after initial installation, our yearly expenditure is low, less than $10,000 per year. So it's reasonable to assume that we can well establish a program that could actually pull more people in versus not having it to begin with. And then, of course, it may be used as a marketing technique to just demonstrate high quality care. We could feature the simulation lab on our webpage and in our graphics so that people know that when they come to our hospital, our nurses are well trained in using some of the highest technology available and that they have opportunities to practice life-saving skills outside of patient rooms. So I think overall, it's not only feasible, but it's beneficial for the hospital. Does anybody have any questions about the simulation model, Apollo himself, or anything in relation to why this would be a good expenditure for our facility? All right, if there's no questions, I have my references on the next slide. Please feel free to reach out to me, and we're looking forward to getting a simulation lab in St. Elizabeth's Hospital. Thanks.